Welcome to the fourth session in our Power Tools for Coalitions webinar series. Today's topic is the USBC Strategic Framework, Protecting, Promoting, and Supporting Breastfeeding, a Public Health Imperative. I am Kinkini Banerjee, the Coalitions Relations Manager at USBC, and I'm so glad to have you join us today. This Power Tools series is part of our training, technical assistance, and capacity building support to the network of state, territorial, tribal, and community breastfeeding coalitions across the U.S. Our webinars are free and open to all interested breastfeeding advocates, coalition leaders, and members, and anyone involved in forming or leading nonprofits in the breastfeeding field. All our announcements are sent through the USBC's Coalitions announcement list. If you're not already on our mailing list, you can go to our website, www.usbreastfeeding.org/sign-up, so you can receive all our announcements. All sessions are recorded and archived, so this session will also be recorded and archived, and I can imagine that many of you will be looking to revisit and share this with your peers and friends as well. So the webinar details are all on the registration confirmation email that you got, and it's also on the Power Tools webpage on our website. But also know that if you check your chat box, you'll see the link to the strategic framework on our website. So do use the chat box as often as you can. So I'll go over some very brief housekeeping. We have a lot of participants for this webinar session, and so everyone is in listen-only mode, but we really encourage a lot of questions from you. So do feel free to type in your questions in the chat box, and they can be submitted at any time during the webinar. So here's how you do it. So you should see a control panel on the right side of your screen. In case you don't see it, it may have been minimized. Just click on that orange tab and it'll pop right out. So under the audio section, you'll see a panel called Chat. Click on it and it'll open up a text box for you to type in. So we encourage your questions, and we will have a Q&A session at the end. And Megan, our Executive Director, Megan Renner, will be moderating the session and will be passing on your questions to our speakers. If you have any audio or technical issues during this session, you can email office@breastfeeding.org. And I'm so glad now to present our first speaker, Beverly Curtis, who's the chair of the Board of Directors of the U.S. Breastfeeding Committee. We are so glad. This is a very exciting time for USBC, and we are so glad to have Bev at the helm. Beverly will be joined by our Executive Director, Megan Renner, who will be doing the second part of the presentation. So I'm going to turn it over to Megan first.
Wonderful. Thank you, Kinkini. So I'll just make one final note here. As Kinkini said, our topic today is the USBC Strategic Framework. And we do have the download link here shown on your screen, and as Kinkini said, we've also chatted it to you in your webinar control panel chat box. So I would actually recommend, if you haven't already downloaded and looked at the framework, that you might want to click that link now and either print it or have it up on your screen next to the webinar. It will be helpful to refer to as Bev talks about it, and then I will talk following her. So again, you have that link there, and it's just a one-pager that you could refer to throughout the webinar. So without further ado, I'm going to turn it over to Bev to start us off.
Thank you, Megan. It's such a pleasure to be here today. Good afternoon, everyone, and welcome everyone from coalitions from around the country. What an exciting day. This webinar is focusing on our journey from moving from a strategic plan to a strategic framework, and how the United States Breastfeeding Committee got to the point where we are today with moving forward with a specific framework for the landscape of breastfeeding in the U.S. Could I have the next slide, please? This framework and a lot of the work that the United States Breastfeeding Committee does, and subsequent work by the coalitions, has been funded by the Kellogg Foundation. And they're very interested in building the USBC staff capacity. They've provided engagements of consultants for support in the United States Breastfeeding Committee, particularly for governance, for strategic planning, for racial equity learning. That's been a significant part of our focus in the last year. And also the exploration of principles and models of collective impact to inform collaborative work. So these are some of the topics that we'll be discussing today in a little more depth. And hopefully you'll have a better idea of how this all sort of fits together as we move forward in the next year or two. Next slide. So for the collective impact, this is a model of operation, in a sense, for the United States Breastfeeding Committee. And with collective impact, you can see that on the left side of the screen, it talks about what common committees do. They have specialized agendas. They have some measurements that may not be complete, independent activities, some communication with outside committees or other stakeholders, and so often unsupportive efforts. But in the collective impact model, where we utilize the strengths of those in our communities, those that are member representatives, those in coalitions, and those with specialties, we can have more common agendas, shared measurement, which is a big part of collective impact, meaning that we take ideas and we have outcomes that we can then have significant data about, that is facilitated and often, in a sense, driven by an organization that specializes in that area or who has expertise in that area. So we have mutually reinforcing activities, continuous communication, and a backbone organization, an organization that where a lot of the energy comes, from for collective impact, but where the work is done often in other organizations. Next slide. Our backbone organization, these organizations pursue 6 common activities to support or facilitate collective impact over a life cycle. So the backbone organization guides the vision and the strategy, supports the aligned activities, establishes these shared measurement practices, will build the public will and advance the policy and mobilize the funding. So it's a lot of work that helps things happen. Next slide. And the collective impact puts the participants in charge of what efforts would benefit from the collaboration, and also puts the backbone organization in charge of supporting how this collaboration works. So the participants do the what, and the backbone organization does the how. Next slide. All right. So with the strategic planning approach, we wanted to engage stakeholders and make sure that they were able to inform the entire process. We were very committed to this approach. We wanted to use feedback from the USBC member surveys, the experiences, of course, of our members in the coalition and the coalitions, and we sent out a needs assessment so that we could gather some more information and see what the coalitions were interested in, as well as our members. The aim of this was to design a framework, not a plan. Plans are a little more specific, and they have very set limitations in some ways. The framework idea is that it's a little more high level. It has goals and objectives, but it's very, very flexible. And in the landscape of breastfeeding, as we know, there are many, many changes. We have a very fast momentum in the nation right now regarding all the initiatives that are happening through many, many stakeholders. And we wanted to be flexible enough so that we could respond to any growing needs, any new initiatives, as well as be able to lead and guide and direct as we would need to. So the flexibility was important. We incorporated the principles of collective impact in order to engage the members more deeply and our partners. So the next slide shows our methodology, meaning that we had a design team. We actually had strategic planning facilitator who came and discussed a lot of this with the board. The facilitator had interviews with individuals. We reached out to members and coalitions with surveys. We knew we wanted to gather as much information as possible from as many people as we could. The board first appointed this design team, then designated 7 individuals with various roles and experiences with USBC to be interviewed by our facilitator. And this helped inform her of the perceptions of the members, the coalitions, and the partners. At the same time, we did the online survey that was launched, and we got a deeper engagement with 2 different member listening sessions, where we had listening sessions for members, and then we had them for coalitions. And in a virtual town hall meeting, we listened to interested mothers and grassroots organizations and others, and asked some very specific questions. And then we gathered up all those answers and moved forward. Next slide. So how do we harvest this wisdom? That was of all this collective information. Now, we used what we call a collective impact lens. So it was critically important to us to hear from individuals both within the organization as well as outside the organization to make sure we had a diversity of perspectives that we considered in the planning of this strategic framework. And since we knew we were building something new, we took a slightly different approach than probably anything we've really done before. Rather than focusing on activities or policy or interventions that we thought were needed in the field, which, as we know, the Surgeon General's call to action did that extremely well, and I think we use that as a springboard now. We looked at things just a little bit differently. We wanted to look at existing and emergency external shifts and trends, things that USBC really can't control, and then internal and external challenges that we might anticipate on the horizon in the next 5 years or so, because our framework is supposed to try to address and be flexible within the next 5 years. And then what are the primary roles and functions of the United States Breastfeeding Committee? So for those of you who've been studying the collective impact model with us, and we certainly discussed it before, but it may be new to many of you, it is a little bit hard to wrap your head around. So you may recognize this term now that I've used, the backbone organization, and that is typically what we've envisioned the United States Breastfeeding Committee as being, the backbone organization supporting how things get done and holding the space for the collaboration for around what activities the participants prioritize or that they align on to collaborate on. So there is a freedom here, and the freedom is that if there's a group of individuals who would like to collaborate and they know what they want to do, then they can they have a lot of ability to do that with the how from the backbone organization. Okay, next slide. All right, so our listening session objectives, and these were very exciting to be part of because a lot of people had some significant input into these and emphasized a lot of, and gave us a lot of information that we used to build our strategic framework. So we sought impact on the United States breastfeeding roles in guiding vision and strategy for the field. We wanted to convene stakeholders and support their aligned activities as well. We wanted to know how to establish these shared measurement practices for activities. Obviously, we wanted to build public will to prioritize the support for breastfeeding. We want to articulate and advance a national policy and advocacy agenda. And you can see the rest on the slides: mobilize funding, serving as a communication and network hub, and engage national organizations. So those are the things that we were seeking input on about our role for USBC. Based on the listening sessions on the roles and the functions, that allowed us to gather a lot of feedback about what people value in our work. The next slide, please. And so the listening sessions opened with a brief overview of our roles. We were using an innovative virtual meeting platform, so participants were then able to select 2 of the outlined roles that you see listed here, 2 outlined roles for further exploration and conversation, and we had small breakout sessions. So participants on the webinar similar to this in many ways could then pick a breakout session that they wanted to go to and then have conversations in small rooms and come back to the webinar again. It was actually pretty snazzy. We really enjoyed that and got some very, very nice ideas in these discussion sessions. We worked towards a deeper understanding of the individual impacts of each member and partner organization. A lot was explored regarding shared agenda for collective impact, and we asked some very specific questions. What advice do you have for the strategic training? The strategic planning design team and board, and then we came to some conclusions here. Next slide, please. All right, so this was an experiment for us in a new format to engage the general public. We did ask 5 key questions, and the public typed answers in the chat feed while the guests answered the questions. So after each speaker, the USBC summarized what had been learned in the listening sessions. And this was our first attempt to meet the masses, so to speak, in a virtual town hall meeting, and we found that it was quite exciting. Next slide, please. These are our people who asked the questions. So we had 5 folks asking questions, and then the questions are listed here. What brings you to this conversation, and why do you care about breastfeeding? Who are you, and what ways do you want to connect to USBC? What other shifts and trends should USBC be thinking about? What policies, and this is on the next slide, what policy challenges would make a real difference in your life or work? And how should the United States Breastfeeding Committee engage and involve grassroots advocates in order to build public will to support all these policies? The feedback was extremely positive. The participants were active and lively, and I don't know if any of you on the webinar had a chance to be part of this, but it was really quite a bit of fun. And the feedback was people loved the town hall. Often they stayed on after it was formally over and just kept chatting with each other. So we hope to have more town halls. But with that, we were able to compile a report and listed on your next page. And we did summarize the comments and sort of have an aggregate grouping of member comments versus coalition comments. And we received obviously a lot of feedback on the USBC roles. What's working well, what can be improved, new ideas, and things to consider. So after we gathered all that information from many, many conversations, we brought it all to the board and informed the board in person in a facilitated work session. So now, after you understand that methodology, excuse me, of how we did that, these are our findings. Okay, so there was a consensus that our 5-year plan that we had been following was dated, and it really didn't fit the mission or the vision as perceived of USBC anymore. So there was large agreement with that, and that we needed to actually review the mission and the vision and make it more in line with the landscape and the needs of breastfeeding in the United States today. It was also identified that USBC is the best organization possible to take on the task of crafting a national vision and strategy for breastfeeding. Not to say that USBC does all the work, but that we can actually help lead in a positive and clear way for breastfeeding work in the United States. All right, so with the idea that the USBC is the strong position leader in the field, we also identified through these conversations that we have internal challenges. that we have concerns about long-term sustainability as an organization, and also prioritizing all the work that needs to be done. There's a lot of work that needs to be done, and there's a lot of groups and members and organizations already doing this work, and there's a lot of work that that some organizations could be doing and they're not doing. So those are a lot of the sort and sift type of challenges that the United States Breastfeeding has, as well as other organizations. And then the external challenges, of course, are things that we hear about every day: cutbacks in federal funding, and the balancing of competition versus collaboration among our diverse members and partners. So these are the perceptions of our greatest challenges. We have opportunities as well, and the perceived opportunities, the greatest, and I think we're all aware of this, is the incredible momentum around breastfeeding, the visibility of breastfeeding now in our nation, and all the efforts that have happened in the last several years to bring breastfeeding to the forefront in many, many conversations. Building capacity for consistent messaging to all stakeholders, leveraging both to increase public will. There's also a true sense of urgency. This is the moment when many, many people have their eye on breastfeeding in the United States. Healthcare workers for the first time often, employers for the first time, government officials often for the first time. People are starting to see the public health issues related to breastfeeding, and the advantages of breastfeeding, but the long-term benefits to our nation, for a healthy nation, for those who continue to breastfeed. We do have some cautionary notes as well, and the cautionary notes as well came from the town hall meetings and responses from members and non-members, and that is that we have a field that the culture sometimes in the field is non-inclusive. People feel that it's clubbish at times. We've been identified as, those breastfeeding folks don't let others in sometimes, and within the groups of breastfeeding helpers and trainers and coalitions and others, sometimes there's tension between groups. And there was an identified need to change that culture. Sometimes there's strife and conversations regarding equity and disparity that need to be addressed. Our tent needs to be broadened, and individuals and groups need to work together better. And then the USBC leadership does not have as much diversity within our own leadership in terms of age and race, professional background, as would be optimal for a national organization functioning as a backbone organization. So in all this, it was a very open and transparent process. We enjoyed and really wish that we continue to have this very, very wonderful feedback. And in the future, we welcome anything that comes up, even if you think it might be hard for us to hear, because we are growing as well and learning and trying to move forward in the best efforts to support breastfeeding in the United States. All right, so our feedback on the USBC roles, and these were ranked, highest, average, ranking to lowest, was that we need to articulate and advance a national policy and advocacy agenda. And that was described in our deep dive in these 8 roles as a prioritized role. Guiding vision and strategy for the field. Convening cross-sector stakeholders to support aligned activities. So we want people to get together. We want to build public will to prioritize support for breastfeeding families. Mobilize funding to support the USBC and the field, and serve as the communicator and networking hub for the field. We want to increase the capacity for the breastfeeding coalitions and establish shared measurement practices for these aligned activities. Those are our 8 roles that have been prioritized. Next slide. Okay, so our hopes for the resulting framework was to develop a roadmap. We need a map to follow in some way, and this is an innovative roadmap that provides the flexibility we need. We wanted to focus on a specific number of goals because there are many, many, many we could choose from, but we wanted to address how to best accomplish our function, our convening function. We want to think about making the biggest, most open, most welcome tent possible, and that is such a priority now that we work together to move forward, not separate from each other. And then we build it for sort of a nimble response, a flexibility, as a model also for state and local coalitions. So as this large coalition actually convenes and works together, you can see that model on your state and use the model for your state and local groups as well. Next slide, please. All right, so this is what you're looking at now is our new strategic framework. And as we look at that, we have protecting, promoting, and supporting breastfeeding as a public health imperative. That is our banner proclamation. And then as you move into the strategic framework itself, you'll notice that in the center it has the vision, the mission, and the values. The mission is on top, and then vision and values. And the mission is to drive collaborative efforts for policy and practices that create a landscape of breastfeeding support across the United States. The center focus is to support breastfeeding families. And as you see, our center logo there is a breastfeeding family that is actually surrounded by this vision, mission, and values of thriving families and communities, leadership, integrity, and inclusion. Next slide. The leadership, the U.S., and these are our value statements here, the leadership, integrity, and inclusion. The USBC depends on the development, engagement, and the inspiration of collaborative leaders who serve on the behalf of our common cause. So this is our notion of what leadership is, that we draw upon the wisdom of organizations, but we serve as individuals. And that's how our leadership group functions. The inclusion is that we place a premium on meaningful opportunities for all voices to be heard. There's a commitment to diversity and equity that we will infuse through our work and decision making. This is a challenge. This is a new framework for us. And as we move forward, I'm sure we'll learn more and more and more about how we have diversity and equity infused in our work. Our integrity is that we champion honesty, transparency, and accountability as an integral process for the success of this collaborative effort. So I hope these definitions of our values give you a clear idea of how we are using these to springboard into our activities and how we function at USBC. If you'll notice on this graphic that we have goal 1, which is be the national collective voice for breastfeeding. However, right above that is equity. And the equity ring goes around the entire framework. And this was done purposefully so that it will embrace all that we do. And we hope that that rings loud and true as we move forward. Our goal 1 is to be the national collective voice for breastfeeding, to support efforts to help mothers, partners, and families to reach their breastfeeding goals. If you want to bring your screen up, your view a little bit so you can see each of these, hopefully you can. But that was 1.1. 1.2 is to apply positive and ethical messaging and marketing practices to build breastfeeding-friendly communities. The third one is to advocate for evidence-based healthcare practices, which is so important in terms of how we actually manage breastfeeding in the field, medically as well as in other areas of care. Advance support and security for working breastfeeding families, and then strengthen breastfeeding research, monitoring, and evaluation to understand and close the gap between evidence and practice. So what we want to do is encourage all to use evidence-based practices in all their breastfeeding support. With using evidence-based practice, you advance the scientific support of breastfeeding, as well as mothers have the best care possible, and then that results in happy families and happy communities. So that is our goal one, to be the national voice for breastfeeding, and our sub-goals underneath that. Can I have the next slide, please? All right. Goal 2 is to ensure organizational vitality. Again, you see our equity ring around there. And we want to assess and strengthen the members, the partners, the coalitions, and grassroots relationships to optimize efficiency and impact. We want to use the governance and management's best practices to be able to ensure our organizational vitality. Of course, we want to embody core values in organizational leadership and secure long-term financial resilience. So part of this goal is so that if we can ensure long-term financial resilience, then we can strengthen other organizations and act as a backbone organization for the nation. Goal 3. All right, engage stakeholders in the collective impact model. Our webinar started a little bit with collective impact, and then this is, of course, reflective in our goals here, that we want to articulate and advance a national policy and advocacy agenda. We want to build the public will and mobilize funding to prioritize support for the work in the field and convene our stakeholders, guide strategy, establish shared measurements, serve as the communication and networking hub, and support increased capacity and engagement. So that's all within engaging stakeholders in this collective impact model. I would encourage all of you to look at, into collective impact a little bit, only because it just makes sense. It helps all organizations in collaboration with others to move forward with strength and unity. And that's certainly what we're trying to do and reflect in Goal 3. Goal 4. Goal 4 is to create a model, to model a culture of inclusion, diversity, and equity. With the landscape of breastfeeding today and the intense needs of specific populations in the United States, we want to embrace equity at the core of all organizational structures and practices. We want to build a welcoming experience for all who engage with the organization, and we also want to integrate equity at the core of all our collaborative work. And we feel this is an intense need in the nation today, and that the United States Breastfeeding Committee can model a culture to help meet those needs. All right, so those are our 4 goals in our strategic framework. If you look at the total strategic framework, you can see that, again, the visual is that there's 4 quadrants with 4 goals. Each goal has the subsets, but again, the family and the family of breastfeeding individuals is in the center, surrounded by our mission, vision, and value, surrounded by the ring of equity. And that is our strategic framework. It allows us flexibility to work within our organization, to build where we need to build within, so that we can build and help those build and on the external edges of USBC, so that we can all work together for the landscape of breastfeeding. Next slide.
Wonderful. Thank you so much, Bev. So this is Megan Renner. If you joined us late, I'm just going to give one more plug to the link in the chat box before I go into the second portion here. So just for those who might have joined us late, I want to call your attention to the fact that the link to actually download the framework, it's very brief. It's just a one-page graphic as Bev was just showing us on this slide. If you'd like to have a copy of that in front of you to refer to while we are having the discussion today, I would encourage you to click that link, and you'll have it right at your fingertips if you had not already downloaded it. So Before I launch into a little bit more conversation around how this is all going to work and especially how it is going to impact you, the breastfeeding coalitions across the country, I'm just going to say a few words about the potential of what's included here as well as the power of what's missing in this new framework. So I'll talk about each goal just a bit individually. And what's included here, if you were looking at Goal 1 on the framework, you'll see that there are 5 specific sub-objectives for it, and that these map to the different sections of the Surgeon General's call to action, the mothers and families, communities, healthcare, employment, and research, right along in order. So that is certainly something we wanted to include and align with. But without also limiting ourselves to that document, which of course is from 2011 and is very, very relevant, but there always might be new things that happen in the field as well. So what's missing then is that the specific implementation strategies or activities, the actions, for example, that are recommended in the Surgeon General's call, there's a lot of additional detail there that is not necessarily included in this framework. And again, we can refer and look to these as a starting point, but that is intentional, that we did not want to limit ourselves to that. There might be other possible activities that could occur. Strategies might need to shift over time due to developments in the external environment. So for example, we know that in the last couple of years, we've had groups of partners in USBC interested in activities around emergency preparedness and infant feeding, or around sleep practices and infant feeding. So those are both just a couple of examples where there's been external shifts or trends, new initiatives happening in recent years that were not included in the Surgeon General's call, but that our framework under Goal 1 gives us that flexibility to still hold the space for those other activities. And they can spring up based upon our participants' levels of interest and engagement in collaborative work around that. A bit more on Goal 2. This goal is typically recommended to have a goal like this in a nonprofit strategic plan focused, again, on your internal organization. This goal actually mirrors what was Goal 4 in our previous strategic plan. That one, you may recall, it was called Ensuring that USBC is a sustainable and effective organization, funded, structured, and aligned to do its work. So you'll see some similar language and similar concepts here in this goal. So it's not as much about what's missing here as what's included and some intentionality in how we framed up this language this year. You'll note that the very first objective is focusing especially on the relationships as the key to organizational vitality across all of our different audiences, members, partners, coalitions, and the grassroots, and is the key to both efficiency and greater impact for us. Also highlighting that there is expertise and best practices that guide all of the different facets of our work, and we've had the great privilege of having some wonderful consultants to guide some of that work in the last few years, supported by the Kellogg Foundation. Thirdly, connecting that emphasis on our new value statements. We didn't have value statements before. That's a new thing for USBC, and really emphasizing how those values are embodied and lived in the organization's leadership day to day. And finally, carving out some space, just as we had in the previous Goal 4, for that imperative on securing financial sustainability for our function as a backbone organization, that being and doing and existing of the infrastructure that I know all of you know and struggle with every day as a coalition, to make sure that you have those functions. And then under Goal 3, we include here, and you'll recognize the roles, as Bev mentioned, of the coalition or a backbone organization are embodied within the different objectives of Goal 3. And it's with a special focus on stakeholder engagement. These are activities under Goal 3 on focus for the entire field. This is not just for USBC alone, but really serving the entire breastfeeding field. So what's missing here is that the Goal 1, of course, provides that high-level framework of what to do, defined by the participants. But then here we focus on the how and these roles that USBC plays. but we aren't necessarily defining a specific procedures that would lock partners into a predetermined way of working in a particular topic area. Each collaborative group working on a different topic is going to define its own terms, and that's another part of the flexibility both of collective impact and of this framework model. Why are we doing it this way, and why is this goal 3 called out? This is a different one that you might not see in a typical nonprofit strategic plan. And that's really because of the uniqueness of being a coalition and of being a collective impact backbone organization. And again, that need to support and articulate the building out of this capacity and how necessary it is for this work in order to be truly effective at supporting collaborative efforts to change policy and practices, to quote our mission statement. But of course, this whole side of the world is often overlooked by funders. It's very hard sometimes. They just want to fund a specific project or an activity. They want to focus on the things under Goal 1. And so by calling out this section specifically in our framework under Goal 3, this allows us to really articulate to funders and partners a better description of not only what we do at USBC, but how important and valuable these roles are to support the field, and therefore why they should fund and invest in this. So it's no accident that this goal is placed at the bottom of the framework. It really is the core foundation on which we move forward. And then lastly, Goal 4, as Bev referenced, this goal interweaves its specific objectives. There are 3 of them that map to each of the other 3 goals. And of course, focus on connecting equity both to the structural and the cultural components of the organization and the field. Of course, what's missing, as Bev highlighted in some of our challenges and pain points that we heard from the wonderful feedback that we got from the field, is that the arrogance that we have already accomplished this, because we certainly have not. We are just taking the very first steps along the journey, and so this is acknowledged by using the word create. We're just beginning to create this culture, and we do hope to model it and support all of you in the coalition to also create similar cultures in your states and communities. And of course, the rationale, as Bev emphasized so strongly with the equity ring, that this is consciously infused throughout the entire framework. So one last note about the framework structure is that we also very intentionally have the clockwise progression set up. So if you're looking at it, you'll see that Goal 1 starts at the top and it goes around numerically 1, 2, 3, 4 in the clockwise direction. And of course, Goal 1 is the beginning point. It's providing the frame for what needs to be done. We have defined what is needed to create a landscape of breastfeeding support in this country. We know that, and we have for quite some time. But then next we have Goal 2, which provides for USBC's internal priorities as an organization to serve its role as the national coalition. And then the next step, as we've said, a newer step in our articulation is Goal 3, which is doing that critical description of how USBC supports and engages with the field. And then finally leading up to Goal 4, which again maps back to 1, 2, and 3 and infuses equity throughout. So what does this mean for all of you and for the work of the field? And as we've talked about this concept of a bigger tent, I'll talk a little bit about what that means. Historically, many of you know USBC's structure has been primarily of national organizations, and especially in our early years focusing on those that are already very active in breastfeeding, and also those who have the capacity to attend in-person meetings. Of course, we meet twice a year in person, and that's where a lot of the action occurs. We also have had our network of state coalitions that we've supported for several years as a key component of our structure and partners, but that has been primarily represented at the national table via your regional representatives. There's been a little bit more limitation in the access of the state coalitions directly to the national organizations. And then the local coalitions or even community-based organizations in your communities have only really connected to USBC through you, the state coalitions. So that's had its opportunities and challenges, of course. Another factor is that a lot of the engagement in USBC work, not all, but much of it has been based upon particular individuals with passion and interest in a topic. So what does the new framework do for us? What are we looking forward to with all of this work, and especially with our equity and inclusion work? It's a few different thoughts. One is that our engagement in collaborative work, especially with collective impact as our framework, can stretch beyond the formal members. And we've already seen that and had quite a bit of fabulous partnerships springing up over the last few years with entities that are not necessarily formal permanent members of USBC. And so if a given project or activity would benefit from another partner organization's engagement, this gives us room for their temporary participation or just participating on one specific project or campaign. And of course, we focus now especially on stakeholder engagement according to their organization's identified priorities and interests. So we really want to go back to that coalition emphasis on the organization rather than the individual, and maximize our impact through that organizational collaboration. So before I talk about what that looks like, I wanted to also reference this Pathways to Policy Change, these 6 common theories or pathways. Our fabulous resource, I'm going to show you the link to an article about it on the next slide. I ran out of room here, but the author outlines these 6 common pathways to summarize some underlying assumptions, typical activities, and provide some tips and guidelines on how this applies to policy change work. So just a few thoughts around these, and you'll notice as you look through these that you can probably identify that multiple of these types of pathways have been active in the breastfeeding field nationally or in your states or communities in the last few years. Certainly we have seen large leaps and significant changes with contextual conditions that finally fell into place in the last few years. The Surgeon General's call facilitated some large leaps, the Joint Commission changes, and of course the coalition pathway. I'm sure you're pleased to see that the work that you all do has a very specific pathway and coordinating activity. Policy windows is another option. Certainly the Affordable Care Act was a contextual factor that encouraged some really fast action and new stuff to happen. We had effectively defined our problem and solutions, and then that policy window opened up and was a very significant one for breastfeeding. Messaging and frameworks, we have also seen this in the breastfeeding field. You may recall the work of Berkeley Media Studies, as well as some of the work that has gone on around framing up the economic cost analysis of breastfeeding. That has really facilitated our work to be able to frame breastfeeding in numerical terms that policymakers are going to identify with. And we know that Congress is all about the money right now, and so that type of messaging frame has been incredibly valuable, and we believe has had an impact as well. Power elites. Certainly this is a little bit more behind the scenes, but we do have the great benefit of some very strong alliances in Congress with key power elites, folks who have been able to move forward facets of our agenda, and that has also played a very big role, although not as visible to the general public, has been a huge impact for breastfeeding. And then lastly, grassroots organizing. Certainly many of you are more close to this in your states and communities, but the lactivist community and all of the nurses and different activities locally and online have been a huge influence on the conversation in the media and the general public around breastfeeding the last few years. So we can see ourselves in all of these different pathways. So, and here you'll see at the bottom of this slide this link, which is a live link that you'll be able to click in the handout. We'll take you to that. There's both a blog about it as well as a longer paper that has great information for us. So what does this mean for us, these 6 pathways, and how does this play out? We've seen so much of our success has been built on having this variety of pathways. Perhaps if we'd only had just one, we might not be at the place of the momentum that we've been referring to and highlighting with our new framework. So we certainly see that for us at USBC, this means that we do need to have a more intentional way to connect from the grassroots to the treetops. And we know from the literature, the collective impact principles, that effective cross-sector collaborations need to include all of these factors: individuals with lived experience, the moms and the advocates, community organizations, state-level coalitions, and the work that you do advocating for policy change, as well as our national organizations that are often leading the trends and the opportunities in the field. So a bigger tent for USBC. Again, we are just at the beginning launch point for all of this work, but we do look towards our new strategic framework and all of the different facets of it to provide a frame for us to review our policies and our practices around our governance, membership, staffing, and coalitions through both that equity lens of Goal 4 and the collective impact engagement lens of Goal 3. And we look forward to having even greater alignment and connection from the grassroots to the treetops. And we do believe that this will impact not just us at the national level, but also all of you, so that when we do have a particular lever for change active in our environment, active around a particular breastfeeding opportunity, that the words that we're speaking and the priorities that we're agreeing upon in USBC national leadership are the same ones that you are seeing in your state legislatures and your state campaigns, and are also the same ones that the activists and the grassroots community are seeing and identifying, and that we are all aligned, because we certainly see that sometimes that has not happened. And what we want at USBC is to really ensure that we can better build that alignment from the grassroots all the way up to the treetops, and work together with all of you to do that. And certainly at the coalitions are in the middle of that, and so you are the linchpin and especially a key cornerstone of that grassroots to treetops connection. So the constellation model is, I lost my photo or my image. So you don't have the visual, I'm sorry. But what is the constellation model? So this is getting into a little bit more of the how is this going to work, and I'm just going to talk very briefly about what this is and how we'll be using it at USBC. There will be much more to talk about in the future as we roll it out. We could have a whole other webinar on just around this and around Goal 3, but for today, I'll give a few highlights, and you can see the definition here of the constellation model. It is a governance model for collaborative social change that has been in use both for national and local activities. We have the great pleasure of having some mentors, especially in Canada, that are using it and that have had great success with it, and we're building out our own version at USBC to specifically align it to the breastfeeding community. And so what it has as its cornerstone are three significant elements: lightweight governance, action-focused work teams, and third-party coordination, which is a reference to that backbone function and those different roles. So again, it has the key feature of having a flexible and lightweight partnership model. Again, the framework really facilitates that. We're not overly directing what collaborative work is going to be, but that is really flowing from opportunism, the natural energy flows of a particular action group, not a rigid plan. And so that also allows us to balance the interests and needs of each partner with the goal of productive collaboration. And we love this term of coordinated mutual self-interest. That is something that can be harnessed where there is overlap of those organizations' interests. That can be truly valuable when balanced and harnessed with the interests of the greater community in mind. How is it different from what we have been doing, or what we might have been encouraging you all to do in the coalitions in the past? Especially, again, this focus on organizational engagement and aligning with the organization's interests and capacity. Again, our strategic framework allows that greater flexibility so that we can mobilize faster when there is a new opportunity like the Affordable Care Act, or a particular new investment or initiative happens in some part of the world that is touching on breastfeeding. It also facilitates distributed leadership. So, as Bev had said, the USBC does not have to lead or do everything. We can't be the beers and doers in every single space of breastfeeding, and certainly we would never want to try. There are many different member and partner organizations that are already funded and working and doing great things in breastfeeding, and so this structure allows us to facilitate and support connections between those folks who are doing that work. And they can come together in constellations and share and align with each other for greater impact together. And again, the lighter weight governance decentralizes and balances power between the partners. Something that we've also seen, that balance of competition and collaboration happens not just in breastfeeding, but in any type of collaborative initiative. This is very common. So this provides us with some greater tools and resources to define how we're going to work together to make sure that we're leaning more towards the collaboration side and less towards the competition. So how did we begin this conversation with our member organizations? We had an engagement survey that we started with each member organization last winter, and you in the coalitions will actually be seeing this next as part of your profile on our new website. I'll show you that in just a minute. But it assessed each organization's level of interest on several topic areas based on the stakeholder wheel. And I apologize, for some reason the graphic is not showing up here either. So I must be having a little technical difficulty, but we'll make sure it shows up in the handout. There are 4 levels of engagement that you would have been able to see here in the graphic: core, involved, supportive, and peripheral. So I'll just show you a bit about each. The core level would be organizations or coalitions that might already have well-established programs or funding. They might already be taking a leadership role or be interested in a leadership role, and they would commit at the core level to sharing risks, resources, rewards, and responsibilities. So this is the top level of engagement, and really being a leader and committing to share in the collaborative effort, both good and bad. The involved level is the next one down, and organizations here would likely have programs, partnerships, or funding, not necessarily all 3, but they might have one of those. They're collaborators and promoters that are willing to actively participate. And they, of course, would commit to coordinating mutually reinforcing activities, but they may not be taking on a deep commitment of risk and reward, but willing to coordinate and participate actively. The supportive level might only be minimally active, but wanting to share information, stay up to date. They might want to sign on in support of advocacy and disseminate activities, but not necessarily be an active participant. And then lastly, peripheral is not necessarily currently active, maybe only a very minimal level of interest. And so these folks, this could be, for example, if we had a organization that is a workplace wellness organization, they came into the USBC space, they would probably only be peripherally interested in some of our other topics in communities or healthcare. They would probably be much higher on the workplace side, but having the peripheral level allows them to designate that, okay, we're not really active here, and they have a way to differentiate that for which specific constellation or which specific topic they want to engage in. They also might still be exploring the feasibility of investment in this area, so that could also be that they're just not quite sure yet, or they don't have funding or capacity to engage yet. So we have taken these different engagement levels and all of the data from our members and piloted the constellation model, at least some initial incubating conversations. We also, meanwhile, had a few areas where we were already funded or being considered for funding that has now come to fruition in these particular topics to convene collaborative work. So these 4 areas that you see here are ones that USBC is poised to steward a constellation or a collaborative group around now. And why did these particular topics come to be? So these are typically going to be an area where there's a particular niche or a need for a neutral convener, some substantive reason why USBC would be the one that gets involved. Then maybe there is a gap, there's not somebody else active in that area, or another possibility could be that there's too many cooks in the kitchen. Maybe there's so many different people active in the area that they need a neutral convener, or they need a coordinating entity to come in. So just a couple of the ways that could happen. And then also that USBC would have funding and capacity to steward or project manage the collaborative work. So those are, of course, coalition capacity building, and that's the work that we've been funded to do to support you for many years now. Continuity of care, and we've, of course, been working around that with the Best Fed Beginnings initiative, as well as our early pilot work of collective impact funded by the Kellogg Grant. And then we have new sources of funding that are supporting innovative partnerships and collaborations around workplace support, as well as around lactation support providers. So these are the 4 that we are funded and poised to steward now as a constellation that USBC convenes and supports. There are many others possible, of course, and this list is just a few of the ones that have had prospect or planning discussions at USBC membership meetings. Again, USBC can be the primary backbone and provide that space for convening of conversations related to all things breastfeeding, but we don't necessarily have to be the leader or the principal doer in every single space. And so to honor those limitations and maximize the capacity of the field, there can be other constellation leaders or stewards that emerge to lead these different topics, and of course many others. So these are just the ones that have had initial conversations in USBC space, but by no means is an exhaustive list. There are conversations that will be incubating and continuing with these topics as well, to see if they would like to formalize into a formal constellation over the next 4 to 6 months. So back to the USBC supports, want to mention that we have our new website that will be launching this fall, and there are a few different facets of it that are especially key that I want to call out here. The profiles for the organizations and the coalitions, whether it's a member or partner organization or a state coalition, profiles for entities will have some different really exciting features, including space for you to tell us your activities, resources that you've published, links, that will have a space to separate these by different topics, and then for folks to come to a directory of what are all of the different activities going on in breastfeeding, and to search them for different keywords, different topic areas, as well as searching by what's going on in a particular state. Another facet of your organization or coalition profile will be to define your engagement levels on all sorts of different topics. So those 4 different engagement levels I just mentioned, you'll be thinking about, and you'll be asked to think about, where does your coalition fall on those 4 levels for different topic areas in breastfeeding. And then, of course, then you'll be able to connect with others in online communities and using online tools that will especially make sure that it aligns with your engagement levels. So there will be a way for you to define, I am really core or involved on this issue, and so I'm going to ask for a higher level of connection to an online community or to a listserv or to regular communication updates about that topic. But maybe I'm only peripheral on this other one, and so I don't need to get updates about that one. So you'll have a lot of flexibility to define, both for your organization, and then you can also see down here for individuals, the same thing, that engagement level and how you then connect and receive information and collaborate with others will be based upon your interests and engagement levels. And of course, I should also say you'll be able to change your profile and engagement levels over time. So this is fluid. It can change depending on your coalition's capacity or emerging needs or trends. So it's not a one-time thing. It is a profile that you'll have the control to update at any time. Then specific tools for coalitions. You may have heard about some of these before, but Of course, our Coalition's electronic forum has been our space to house resources for coalition capacity building over the last several years. This is being revamped and will turn into a new and improved Coalitions Connection area. So that will be, of course, open to all coalition partners. And then state-level coalitions, states and territories, I should say, the U.S. territories, will each have their own private online community. And you'll be given special training and be able to set your own moderators to manage this for your coalition. Again, of course, it's optional. If you aren't ready to use it right away, that's totally okay. But the site is being built out with a default that every single state and territory coalition will have this available. So it will be there for you, and we'll be able to provide training and support to you to use it. And this is just the sampling of the tools that will be provided as a default: blogs, listservs, file libraries, a roster, so that you could have a way for anybody that's affiliated with your coalition to see each other, as well as a calendar if you wanted to have your own state coalition calendar and use that as part of your community to show the folks on your roster what's going on. So it'll be really, really a valuable space and very exciting, we think, and we're very much looking forward to providing trainings on that this fall and winter. So that is a website piece, but that is not the limit to the different backbone supports that would be part of how we incubate constellations and support them once they are formalized. The website and the online communities that will be available for each constellation as well. That's just the first part, but other supports that a constellation might ask for from USBC could be meeting time or space if they'd like to get together during our membership meetings, as well as before or after. They might also look to us for consultant training and coaching. That could be, for example, specifically around the convening, the strategizing functions, or the measurement and evaluation. We do have access to our collective impact consultants that can help with those parts especially. Advocacy for and mobilization of funding. We've certainly been doing some of that with our appropriations work and continuing to build relationships out in the field, both for private and public types of funding. And also communications. We hope that many of you are already familiar with our weekly Wednesday Wire newsletter. We, of course, will plan to continue that and also launch into some new communications tools that we'll have launching with the new website, including a blog and other ways to specifically target the information that you want to have about a specific topic in breastfeeding. There'll be much more opportunity for that continuous communication internally within the field as well as to the general public. That's just some of the supports that we can provide. And again, we'll offer a menu of options for different constellations. And what they will do is then negotiate with USBC about a specific terms of reference of how they will work with and interact with USBC and which types of supports they would like to receive. So what does this mean then for coalitions? Of course, we expect that we will be able to expand and make even more robust networking opportunities with one another and for you all with each other. The website and meetings and constellations will also facilitate greater direct access to the national organizations. We know that's been a barrier in our current technology system, and so we're looking forward to that and to greater sharing of what the national folks are doing with what the state folks are doing, as well as the local and community activities, so that will all be part of the public website, those directories of activities, so that anybody can see and access all of that information, and there's no firewall between those different audiences. Tools to manage and support your own networks, again, those private communities for each state and territory coalition, as well as just greater clarity on how USBC supports efforts in the field in different topic areas. I hope that this is giving you a little bit of a greater idea of exactly the role and function of USBC and how we will work sometimes to lead on different topics, but other times we might support other organizations that are leaders on a different topic. So lastly, before we spend some time on questions and comments, have one new exciting announcement to make that is also a key component of our conversations today around the framework and our new ways of working. So as you know, we have conducted the Coalition's needs assessment, and we are very close to having the summary report of those results for the whole country. We also are moving towards a self-assessment tool. You may be also aware that we created a matrix of markers of effective coalitions that is aligned with the needs assessment survey. And that is now being also aligned with an integrated resource and reference guide. Those two factors, the definitions of the markers of effective coalitions as well as the integrated resources and references, will be put into one self-assessment tool that will be a fabulous resource for all of you to look at your own coalitions, look at your structure and function, your leadership, your membership, your activities, all of the different areas, and to help you to assess and prioritize where to go next and what to do with your own coalition development and capacity building, and what sorts of training and technical assistance opportunities you'd like to prioritize from what USBC offers through the next part, which is, of course, our training and TA opportunities. And as we have been for several years, we'll continue to do that through a different modes, online, webinars, in person, and so on. The new exciting piece is that we have a new cooperative agreement funding from CDC that will continue to build out and expand these offerings. We, first of all, will be having a more robust capacity building plan and tailoring the content and the supports that we provide to the different stages of coalition development. So again, as you are looking at your self-assessment tool through the matrix and the different markers of coalitions, you'll be able to align that with our capacity building plan and the different types of content and see, gosh, you know, we're in this stage here, and so this particular opportunity is one that our coalition should take advantage of now. Maybe next year we'll take advantage of this other one. So it will be first building out that capacity building plan, and then secondly, creating regional learning collaboratives that we'll plan to have around the country, and also integrate into the National Breastfeeding Coalitions Conference in future years. So the thing to know about this particular funding opportunity, though, is that our first year, which just began in July, is a planning year. There was not enough money to actually begin the regional collaboratives in the first year, so we'll be focusing primarily on planning this first time, and then we would look to start up actually hosting the collaboratives in the 2015 to 2016 federal funding year. So that's the timeline for it, but we will be rolling out different components of the prep work and asking for your feedback and input along the way. So you'll hear more from us even in this first planning year along the way. Also wanted to highlight a couple of really critical factors here that, of course, as we continue to say every time that we speak with coalitions, that we are continuing to vigorously advocate for more direct funding for the state coalitions, and especially we know that you all need this funding to emphasize your staff capacity and not just be relying on the backs of volunteers for the critical policy and systems change work that you are doing at the state level. Another component of that is that this new cooperative agreement does have a secondary objective, a second objective that is focused on increasing working relationships between state coalitions and your state health departments, and especially to encourage breastfeeding's integration into the public health agenda in your states. So, of course, we know that in many states that relationship is working really, really well already and has been for many years, and in other states it may not be, and then in other states it might be that you are connected with some parts of the health department and not some other parts. And so we're very excited to have some new relationships with both ASTO, the Association of State and Territorial Health Officials, and NACHO, the county and city health officials, to facilitate that greater connection from multiple angles. So we anticipate some greater work from the national level top down, as well as some supports that we can provide you from the bottom up to really build a strong partnership with health departments in your states. And of course, that will also result, hopefully, in some greater partnerships as well as funded partnerships in the future for breastfeeding coalitions. So especially wanted to highlight those factors because they are very prevalent for us all the time in our work at USBC. So I will put it all together and tie it all together and show this lovely quote from Bev, our new USBC Board Chair, and take this moment to remind folks that you can type your questions or comments into the chat box, and we will have some time here, spend the rest of our time doing some question and answer. So bear with me a moment. I'm going to check out what we have. Let's see. So our first question is asking, I think, about the facilitator and the consultant folks that we had. It's asking whom or what type of professional helps to develop the framework. So if I'm reading that correctly, I think you're asking about the facilitator and the consultants. But if I'm misinterpreting that, please type it back in. And so we had our facilitator was actually the same consultant that we had worked with from BoardSource. Her name is Susan Meyer, and she had worked with us the previous year on our governance and nonprofit governance practices. We also had some input, especially from our collective impact consultants and the Tamarack Institute in Canada. So if you're interested in either of those folks' information or either of their entities, the BoardSource or Tamarack, just please don't hesitate to contact me, and I can connect you with the right web links and folks at either place. Let's see. Some long questions here. We have another question about what platform can we use to ask questions in the future, which is a really good question. So I would suggest a few different opportunities for that. One is that, as Bev said, we are going to do more town hall meetings. So we do plan to do those, and I know the advocacy committee is very keen on doing those for, especially to focus on some different possible advocacy priorities or legislative priorities, and to have some conversations with the field about them. So do look for those as a great way to engage and chat at a deeper level. And of course, these coalitions webinars and our bi-monthly series that we co-host with CDC in the opposite months, in the even-numbered months, is another opportunity for questions and reflection on those. And I guess another opportunity would be our state coalitions discussion list. We do have, so if you're not on that list now, I'm going to actually navigate you there really quick and show you how to get on that listserv. Bear with me one moment. So if you are on our website, and you should be able to see that on my screen now, and you go to this coalition section, under coalitions, the very first section is called Coalitions Resources, and that can take you to, under the national email list, there is both the subscription to USBC's email announcement list. That's the one that King Kitty mentioned earlier to get announcements of webinars. And the second one is the discussion list. So that would be another great place to have some additional conversation in the coalition community around the strategic framework. So I would also encourage folks to use that, not just for chatting about this, but just in general. It's a great resource to share and ask questions of each other in the state coalitions. Let me go back to the slide here. Let's see. So there's another question about the website, whether anyone can become a member. Looks like it got cut off. So the access to the new website, there will be different levels of engagement with the website for sure. There certainly will be some features that are specific to members, some features that are specific to coalitions. And as you join the website and you define and get connected to different communities, you'll have access to different communities depending on your selections and your profile and how you set up your engagement levels and interests. So it will actually be relatively sophisticated compared with our current system. So I know that's a little bit hard to grasp at the moment, but when we do launch the site, there will be, again, webinars to launch and explain how to use it and how different coalitions and different audiences will use the features that are specific to them. So do look for that. We will, of course, announce those webinars on the coalition's announcement list and in the weekly Wednesday Wire as well. Let's see. We have, I think this is a comment, so I'll just read. It's very important is the need to fund at the local level. As the quote says, it takes a village, and breastfeeding efforts must start at the local level. Small communities often do not qualify for many funding opportunities because the data isn't available or it doesn't hold weight against the larger urban communities. So a very good point. I would actually highlight, and I'll try to find, or Kinkini, if you're able to chat the link to the NACCHO funding opportunity,
sure,
that might be a really nice one to share with this commenter as well as with the whole audience. If you have not seen this yet, NACCHO, the partner that I mentioned, the National Association of County and City Health Officials, has an active RFP right now to fund 70 different communities around the country to work on increasing access to lactation support in their specific communities. And it is specifically targeted to communities that have a greater than 50% African American population or who are underserved. So I know they do have some very specific mechanisms there to engage with the rural communities and underserved communities that like you're saying, don't always hold weight against the larger urban ones. So we especially encourage you to check out that opportunity. I see Kinkini has chatted a link to us in the chat box, so do look for that. And of course, as there are more opportunities like that in the field, certainly we've seen a lot more investment in breastfeeding. We do share those in our weekly Wednesday Wire, so we encourage folks to check that out and to be on our mailing list. Let's see. Do we need to be nonprofit to receive support and possible funding? I'm not sure if this question is asking about. I guess it depends on which type of funding we're referring to. If you are talking about potential for funding opportunities through USBC, to coalitions in the future, then the answer would be no, not necessarily. It is a little bit tricky, though, to define what it means to be nonprofit versus having your IRS, 501c3 tax-exempt status. So if you're not familiar with what I'm talking about there, I would actually encourage you to check out the Power Tools webinar, the first two that we had in the series, where we did get into those different types of status. What you would have to have as a coalition in order to receive funding through USBC, you either have to have incorporation, you just have to be a legal incorporated entity in your state, or you have to have a fiscal sponsor who can accept the money and that we would contract with on your behalf. So it can be one or the other of those things when it's funding coming through us to coalitions. If you're talking about other types of funding opportunities, though, I can't necessarily speak to those because it's very specific to which type of funder it is. Oftentimes, foundations in particular can only give to 501c3s, but they might also be able to do fiscal sponsor relationships. It can be very flexible. So I would encourage you, again, to check out the first 2 Power Tools webinars and also to look at the specific funding opportunity that you're interested in. Getting your tax-exempt status can really open a lot of doors. It does help, but it is not the only way because, again, you can have a fiscal sponsor relationship with an organization that is eligible, and willing to work with you. Let's see. I think this is another commenter that I'll just read for the group. One thing that I think is that the state organizations need the resources to really cultivate relationships with local geographic and culturally based coalitions. The commenter goes on to say the system hasn't been well supported in helping to build capacity from their state with their local coalitions, and that they hope USBC continues to support the state coalitions and encourages the local coalitions to work with the state coalitions. So very, very helpful comment, and we know, of course, that sometimes as the state coalition network was built out, with the first USBC conference being a real impetus for that in 2006, sometimes there were already local coalitions and not a state coalition. So we know that your different structures and different situations of state and local coalitions in different states varies immensely. And so we're always very interested to hear about how that's worked and how that's happened for different states, and especially look to be able to do more of connecting all of you with each other so that folks who have similar challenges or opportunities in that space can better connect and mentor each other. Let's see. There's another question. There's a few different questions about the regional learning collaboratives, including about eligibility and who would be attending. So of course I'm going to say that this is in the early planning stage, so we don't have anything definitive yet on that sense, but what we do know is that it will be for each coalition that attends. We do intend for it to be a team that is sent, so perhaps it would be a team of 3 folks from one coalition that would attend, and that we might ask that team be made up of individuals with different roles in the coalition. So do expect a team approach, but as far as other eligibility criteria, that will be to be carved out and to be determined over the next year as we do this planning work. We do have as one of the first components of that planning work that we'll be convening a design team to guide that will include, of course, necessarily include some coalition representatives to inform the work. So we'll look forward to sharing more about that opportunity as well. Let's see. I think I've covered these, and I think we're actually getting to time. I do see we have a couple of the typical questions about how to get to the handouts. So we're going to actually post those right now in the next couple of minutes, the handout to this webinar, and it does have live links in it. So if there are any of the links or articles that you would like to click on, as well as the framework link, it will be in there. I don't know what happened to our graphics. So I will just flip back really quickly to show you that link one more time before we close off today. And again, remind folks that the next month's webinar will be back to our even month series for the CDC USBC regular webinars that are held in even numbered months. And Kinkini, do you have that date?
It's October 14th, and we will send an announcement soon.
Wonderful. Yes, those are on the second Tuesdays of the month at 2 o'clock Eastern Time. So mark your calendars for that October 14th date, and then we will see you there or in November for the next Power Tools session. And I have up here on the screen, here's the link to the Power Tools webpage, and the handout will be there just in the next couple of minutes. So thank you, everyone, and we will talk with you very soon. And again, please feel free to write us with any questions that we weren't able to get to today. So thank you so much, and have a wonderful rest of your afternoon. Take care.